Welcome to Vale la Pena. In English, that's worth your while. I'm your host, Cynthia Ribas. This is a show where we get to do some grassroots philanthropy together. In all episodes, we'll feature nonprofit organizations engaged in inspiring projects for people, animals, and the environment. Some guests will be representatives of those organizations, and they'll share with us more about initiatives they're working on and ways we can participate. Check the show notes for opportunities to impact these humanitarian causes together. You can find this show through my website at www.rebuslegal.com and on YouTube, Facebook, Apple Podcasts, Spotify, Google Podcasts, and more. Now, please join me for Vale la Pena. Hello! Welcome to Vale la Pena. Thank you for tuning in. If you've been listening, you know our show is committed to grassroots philanthropy. And the idea is very simple, and it's that we can make a bigger impact together. So the way we do it on the show is we have guests and engage in conversation that we hope you will find inspiring and interesting. And in all cases, we spotlight nonprofits. So if you are moved to participate in any way, the show notes will give you all the direct links so you can engage in the nonprofit organizations that we spotlight. Today's guest, I am so very honored to introduce to you, is Dr. Perry Fine. He is a medical doctor, specialty anesthesiology, subspecialty pain medicine, hospice, and palliative care. He is also a professor at the School of Medicine at the University of Utah. So without further ado, let's introduce Dr. Fine.
Cynthia, I'm delighted to meet with you. There's actually no shortage of things to talk about, especially with regards to areas that really are in dire need of not only understanding but support. But you know, I see a piano behind you, and maybe we should just talk about music. Nothing controversial, just the joyfulness and creativity in life, but art and medicine and music and medicine go together. So I'll take it where you want to lead it, but I'll leave it up to you. But I do see the piano, so I'd love to hear what that's doing there.
Well, I have a very expanded notion of humanitarian causes, because again, the show is aimed at forwarding humanitarian causes for people, animals, and the environment. So if we just look at for people, I understand that to be, obviously, my heart breaks for the crises of population displacements and food insecurity and in all the many crises. And a lot of my other shows focus on injustices in the legal system or issues with animals. And there's just so much work to do. There's also the world of mental health, which brings me to what are some of the things that help humans be healthy mentally? And I would say music is top of the list in terms of bringing joy. I myself dabble in piano. It was a first love. It's always, I have issues that I aim to break through around making time to play piano, but it's an activity that is so satisfying in and of itself to create music, to play music, to create music, to write songs, to sing. And so I know that you share that passion. And I figured we got to get this podcast in front of a musical situation as opposed to, say, my law office, because this is the philanthropic arm of my law practice. So we get out of the law office and we come and actually talk to people about issues. But that's why I'm in front of a piano.
Well, let's start. Let's start on the joyful side with music. We can get into the depths of some of the more angst ridden areas in a few minutes. But your interest is wonderful and very timely for me. During COVID, I'm a lifelong musician. I've been playing music all my life, and have managed to stick with it through. Although, as they said, the expression that medicine is sort of a jealous master is very true. But music has certainly been my sanity through a lot. And then when COVID hit, and due to my age, I was sort of grounded. I was sort of told the best thing I could do as a physician is not become a patient, which was largely true. But it gave me time to not only reflect on things, but also to catch up on almost 50 years of delayed gratification in some of my musical interests. So I completed a symphony, which is actually going to be performed next, sort of around the holiday season for various reasons, and then also a musical. I wanted to write something very uplifting, and musical theater is, the way to do that. But in the meantime, a new initiative I've taken on at the University of Utah is to bring in a very new formed group, the Utah Medical Orchestra, it's being called at the moment. There actually is a National Association of Medical Orchestras, because there's a lot of people in health sciences, not just physicians, but health sciences, who are also musicians and are looking for an outlet. And from a mental health standpoint, from a community standpoint, it's a tremendously important outlet. So we're working to bring this into, and the home base to actually be the Department of Anesthesiology, which is a kind of a weird place to have a home for an orchestra. But I can be the faculty sponsor. It's largely a student organization, but also with faculty and staff of the 10,000 people, faculty, staff, students, trainees, all levels within the health sciences at the University of Utah. There's a lot of extraordinary talent. And we're actually bringing it in as a wellness project. So that's the punchline. So the chairman of our department believes very strongly in the importance of bringing wellness into not only for our students, but also faculty and staff. So that'll be sort of the end of my musical exposition, but it's a very timely thing, and it's actually something I'm spending a lot of my time on these days.
Well, I just want to say, and this is very special, we haven't had a nonprofit of this type, but one of the nonprofits that we're linking will be the Grand Theater in Salt Lake City. And they are a community theater, and like so many theaters, would really benefit from your support if you are inclined, speaking to listeners, to participate. And they are the theater that will be showcasing your work. Is that right?
Yes, they're going to be the world premiere of the musical Fate, with a question mark at the end of it, will be actually exactly a year from now, mid-February through mid-March at the Grand Theater, which is a venerable old theater, 100-year-old beautiful theater attached to the community college in downtown Salt Lake City. And of course, it's a not-for-profit, and it works through grants, and then it supports new productions as well as older ones. Right now, the 39 Steps, which is a sort of a classic, is going on, but the Fate will be there a year from now. So I'm very excited about that, obviously.
Congratulations. That's fantastic. And I'm going to have to make my way to Salt Lake City and go see Fate with a question mark.
It's a rock musical, in the sort of rekindling the days of Hair and Jesus Christ Superstar and those types of musicals. So it's a lot of fun. We workshopped it at another theater, the Alliance Theater, last May, with 100 spectators to sort of give feedback, a true workshop, and it went over very well. So the Grand decided to pick it up as a full stage production. So yeah, everybody come to Salt Lake City, and we should be finished with. I think this weekend is the NBA's All-Star weekend here in Salt Lake. So we've got 100,000 people flocking to Utah for something as exciting as NBA basketball. So let's do it for musical theater as well.
Okay, that's fantastic. All right. Okay, then changing from all this joyfulness that music provides, talk to us a little bit about hospice. What is that for people who don't know what that may be?
Well, hospice actually goes back centuries in human history through Europe and the Middle East as a concept of a place where people would go who had terminal illness to be, well, actually it comes out of sort of hoteling and a place where people could go for sanctuary. As it evolved in more modern times, and then out of Dame Cicely Saunders' work in England, at St. Christopher's, which was sort of the first sort of recognized modern inpatient hospice center, where patients at that point with terminal cancer could go and be cared for rather than back-warded in hospitals, where they could access pain control and be involved in more social activities and live well until they died. In the United States, there was a movement towards more home-based hospice that began in the 1970s, largely around some religious orders and all charitable. And then when the HIV epidemic struck, there was certainly a need for end-of-life care. There's a large population of people who, unfortunately, at that time when HIV was a terminal illness and just rife with horrible side effects and whole constituency of I'm trying to put this in a non-vulgar way, but just bodily functions that just went totally awry, and they needed a lot of care, a lot of personal care. And so the movement really accelerated then in places like LA, San Francisco, New York. And some demonstration projects were underway. And interestingly, maybe one of the last great pieces of truly bipartisan legislation, almost with unanimity, ironically, and I don't mind to give away my political positions here so much, but it's almost unavoidable. But during the Reagan administration, President Reagan signed off in 1982 on the Medicare hospice benefit. So hospice became actually a part of the American sort of, well, as disorganized as the American health system writ large, at least underwritten by Medicare. So it's sort of right at this point, and still has been over the last 40 years, probably the best kept secret in American healthcare, because it's completely covered either under people who already are covered under Medicare, or people typically over 65, or Medicare, Social Security, in which case people who have terminal illness are almost all qualified. So there's almost nobody who has a chronic progressive disease with a life expectancy of 6 months or less, so months rather than years, who doesn't qualify for this kind of interdisciplinary care, largely provided at home by nurses, supported by physicians, counseling, chaplaincy if people wanted, and social work and support to help with things, all the paperwork and financing and all the things that people worry about as they're sort of closing out their lives. But largely it's about symptom management and helping people to live as well as they can and support their families throughout the last weeks, months of their lives.
Why do you say it's a secret?
It's highly underutilized. If you sort of multiply the number of people who die of sort of well understood chronic progressive diseases, cardiovascular disease, stroke, heart failure, cancer, advanced cancers, neurological diseases, and so forth, that accounts for about excuse me, about 80% of the people who die every year in the country. The remaining are people who die rapidly, acutely, without having had the expectation of succumbing to a chronic progressive illness. Trauma, sudden massive heart attack that was not foreseeable. Obviously homicide, suicide, which are big issues, but still that leaves 80% of the population, and 80% of those individuals are over 65. Obviously, the most tragic thing imaginable are the 1% of people who die every year in this country who are kids. And that's probably the most difficult area of hospice care, is to deal with children who are, we know are, whose lives are measured in days, weeks, or months. But that's really the spectrum of people who would benefit from this type of care. But if you sort of add it all up, only about, well, as of the last calculations I've done and written about, only 3 to 5% of hospice days available under coverage and benefit. And by the way, most commercial insurances for people who are not covered under Medicare also cover hospice care. But only about 3 to 5% of those available coverage days are utilized by patients who otherwise would benefit, meaning that 95% of the time in people's lives, or the days that are people, which means a lot of people may not get it. About 50% now of people, at least in the Medicare population, who die every year, get at least one day of hospice care. But in order to really organize care and help people get the most out of what it can be, it really takes not only several days, but weeks sometimes to get people organized so that they can actually live as well as they can. And one other thing I'll interject here is that it's been well studied and well proven that people who actually access hospice care earlier in the course of their disease actually live not only longer, and some people really aren't looking to live longer, but most people want to live longer, but also live better. The quality of their lives goes dramatically up. If you relieve symptoms, if you make sure pain is controlled, nausea, vomiting, other bowel issues, dementia issues, you name it, feeding issues, all skin issues, all the things that accompany advanced illness, people live longer and much better. So when I say it's sort of the best kept secret, it's really not it's a nice trivial sort of throwaway line, but it's actually quite profound if you consider it.
Well, and after this podcast, it's not going to be a secret. We're getting the word out there.
Yay, Cynthia. Where's my camera? Very oolong tea to you. Yeah.
Well, I get great listeners. I'm sure they're all going to, be looking into. It's just a curious thing. I don't know if it's a matter of people don't explore the benefits because it's just complicated to figure out what the benefits are.
Oh, there's a lot of mitigating factors, or things that first of all, nobody likes to think about terminality or mortality or death. I mean, this is an age-old issue. It didn't begin or end in any generation, including our own, no less going forward. And it's problematic because unless people plan, things happen regardless. I mean, it's like an avalanche. You really can't stop it. And until you really organize your life around thinking through what's going to happen and getting your family members and your, a lot of people don't have a primary care physician. There's a lot, this is a very vulnerable population that oftentimes is poorly represented and amidst other very obvious inequities in medicine and healthcare in our country, this is a big part of it. But I guess this would be a plea for everybody, for their own sake and their family members, if they want to avoid totally bankrupting their family, because it's studies have looked at the results of people who don't plan well, and it's a majority of people, but something on the order of 50% of families who go through the dying of a family member, whether it's a mother, father, sister, brother, somebody close to them who they have some responsibility for, but usually first order family members, basically spend down all of their life savings taking care of that person on a lot of things that are in fact not beneficial, either or just sort of pushing away the inevitable, prolonging dying in a rather than supporting quality living. And it takes a lot of forethought, and it's a difficult topic. We always sort of say, this is not something that you want to necessarily ruin your Thanksgiving talking about, but there are only a few times a year where people get around the table all together, and it's a tough one. But there's a lot of, you can search for these kinds of things, how to break the ice, and talk about these things online, and there are organizations that help people through this. difficult conversations and the conversation project and things like this. But anyway, it does really take planning and written directives, so people aren't guessing. The default if people go to the hospital and don't have a directive is, everybody throws everything at them because people feel there's a liability issue, and in the end, our health systems are stressed financially. Resources get directed towards futility rather than towards meaningful, helpful care in those sorts of ways. So it's very complicated, many moving parts, but it's really up to us, our individuals and people, when we still have a few neurons left, that are working. That's the time to figure stuff out, not when we're sort of no longer in control of our own lives.
Well, there's so much I want to speak to there that you mentioned. One that I can relate to as a lawyer, as I do a lot of estate planning, and it's a similar thing where families have difficulty sometimes just having the conversations in order to get the planning going, so that the intentions of how to take care of each other and then pass wealth can be fulfilled. But we have to have those conversations. So that's what we're doing. We're encouraging, talking about things that matter. That's what we're doing.
Well, it's really is, our national organizations helpful. Yeah, they can be, but really most of these boils down to locally. What's in your community? And quite frankly, there's a tremendous amount of disparity amongst hospice programs. Under Medicare, the Medicare certification is something definite to look for because there are standards. But still with that, there's a lot of variability. So word of mouth is really important. Talk to other people. If your spouse, your loved one, your friend, your brother, your sister, your aunt, uncle, mother, father is diagnosed with a condition that in fact appears to be incurable, that's the time to start looking and interviewing programs and see what do you offer, what limitations do you have, what's covered under Medicare. People should seek out the Medicare hospice benefit on the web under Medicare. They can look and see what should be offered and make sure their hospice programs do it. I will recommend, if it has nothing to do with Utah, where I reside, but one of I think the most forward-thinking programs in the country actually is out of a little town in Arthurdale, West Virginia. And West Virginia has a host of social issues and problems and all sorts of wonderfulness. It's it's an extraordinary, beautiful state and with tremendous resources, but also has one of the oldest aging populations in the country. Has a lot of chronic illness, largely left over from and still going on with coal mining and all sorts of things. But West Virginia Caring and WV, West Virginia, WVCaring.org is the website, and they refuse care to no one. They take care of anyone, anywhere, and are trying to accommodate people where they're at throughout all sorts of rural areas of West Virginia that maybe as the crow flies, maybe only be 40 miles, but might take 2 hours to get there over mountain roads. So this is an organization really worth supporting if you feel like you're supporting an organization where that every penny that you donate will go directly to helping somebody's life be better. That's one I would strongly recommend.
Great. We'll definitely include them in the show notes.
Great.
Thank you for tuning in to Vale la Pena. Please join us in making an impact together for people, animals, and the environment. Details in the show notes. You can find this show through my website at www.ribaslegal.com and on YouTube, Facebook, Apple Podcasts, Spotify, Google Podcasts, and more. I'm your host, Cynthia Ribas, and I welcome and thank you for your feedback, comments, questions, and sharing this show with others.